Data has shown us that when breast cancer patients are taken care of by specially trained physicians, they have better outcomes. That, unfortunately, is a very significant challenge in rural communities having access to that level of care. COVID rapidly increased the use of telehealth, and we took advantage of that to be able to realize how much more we need to be doing. We have significant challenges still with telehealth because of access that patients have from Wi-Fi or broadband access. I'm very excited about the program that I've put together. It allows patients in rural communities to remain within their rural community and have direct face-to-face conversations and physical exams with a specialty trained provider at an NCI designated cancer center. There are studies that have shown that 43% of breast cancer patients that have a second opinion at an NCI designated cancer center have a change in their diagnosis or in their treatment in some capacity. And that is why this is so important, because we talk about equitable care. Well, that has to start with their access. The future state of healthcare is really taking telehealth to the next level. And what is going to be pivotal is offering patients an augmented clinical experience. That is going to require 10G technology so that we have a higher bandwidth and lower latency to be able to communicate with those specialty trained providers in metropolitan areas directly with providers that are in those communities and become a broader team that now has been bridged through this technology. Through the MediView technology and their device that they have partnered with Microsoft, we will have headsets here where I am stationed to practice, and then a headset at the other end in the rural community. This would then allow me to three-dimensionally be able to see the patient as an APP provider or another generalist provider is examining the patient. I therefore can explain to them, I have a concern here, please do some additional examination here. I then am able to take it and look real time with the patient as I would if they were in the clinic with me and go over all of their imaging and point out to them, this is what we're seeing and here's concerns. If a general radiologist needs to be performing additional biopsies prior to the treatment plan being finalized, they can even help guide through this MediView technology the needle placement for those biopsies, increasing the accuracy for patients and the diagnosis.